With the number of cases of COVID-19 rising, it's important to protect ourselves. SteriRight provides mass processing services to extend the life of N95 masks and more. To tell us more about this new disinfection technology is Peter Kalra, President and CEO at Bay Area Health Trust. Thanks for joining us via Skype this morning.
Morning, Bob. How are you?
Good, good. So Bay Area Health Trust, you describe yourselves as the intersection between health sciences and health and the business world. So tell us about SteriRight.
Yeah, absolutely. So SteriRight, like a lot of things, started at the beginning of the pandemic when we were working with different players in the Hamilton community trying to source PPE. And, you know, that became the Wild West. I said that about a week before Christopher Freeland, I like to think. But it got obvious that the N95, that kind of the highest echelon of masks, were going to be in really short supply. And there was a company out of Beamsville that was pivoting from an agricultural use of a machine into the healthcare space. And we looked at that and said that could really help different healthcare facilities, different manufacturing facilities out. And so we took that machine, we put it in a mobile unit so we could get it around the region to help people who needed their masks cleaned and disinfected and extended. And that's where it all started. So we've been busy through the summer. It takes an N95 mask, which are in huge, short supply, and we can disinfect it up to 10 times. So it helps a lot of people.
It's so critical to extend the life of the N95s. I've heard from many health professionals who pre-pandemic routinely tossed them, many during a shift, and now it's important to extend the life of these things. And of course, not just for, in the health sector, but there are many sectors that require N95 masks. So let's talk about the services, and we'll start with the masks, exactly how they clean them, and the effectiveness here. This has been verified by
Health Canada. Under Health Canada's interim order, they've approved the use of this technology. It actually uses 3 types of disinfection technology. It uses, you saw that kind of red light, that's the ultraviolet C. So not the sunlight that you get, but a different type of UV light. It uses a gas, hydrogen peroxide, that we know already cleans and disinfects. And then it also uses ozone. And so with those 3 types of technologies, we know that as masks enter the machine and go through the conveyor belts, it takes about 30 seconds, and those masks are coming out incredibly disinfected on the other end. And so we know again, sorry, Bob.
Oh, no, I was just going to ask, and not just masks, but you're doing entire spaces as well. And we saw some video of some of the spraying that's going on. So this is safe for all surfaces. I'm thinking if you're doing an office with LCD screens, for example.
Yeah, so that's our other service called electrostatic cleaning. And so that sprays a disinfectant. But what it does is it puts a charge on the disinfectant. So if you think back to science class back in high school, as soon as you put a charge on something, it wants to attract to the opposite charge. And so it spreads out evenly, and it also doesn't want to hang around close to each other. So everything with the same charge repels. And
you mentioned you're busy. How many, what sectors are showing interest here? Health sector and elsewhere?
Yeah, the health sector is a tough one for the masks because the masks that are in supply are going to the healthcare sector, and some of the hospitals have these machines. And so it's we can offer it to health sectors that don't have these machines.
We got to go, but I'm thinking of like grocery stores, for example. We hear about the deep cleans after an outbreak. What are they using now, and could they use this?
Absolutely, they could. We could help anywhere where there's a deep clean required.
Okay, wish we had more time, but we'll link up more information at chh.com on SteriRight. And Bay Area Health Trust CEO Peter Kalra, thanks so much for sharing this technology with us.
Thanks, Bob.